Good morning. This is Teresa Ambrose with the Minnesota Department of Health. I am the State Nutrition Coordinator in the Office of Statewide Health Improvement, and I would like to welcome you all to the webinar today. I am here with Karen LaPierre, the Assistant Program Director, Sustainable Agriculture and Food Systems of the Regional Sustainable Development Partnership, and Julie Ralston Aoki, Senior Staff Attorney at the Public Health Law Center. Julie also provides technical support to us for the Statewide Health Improvement Partnership. We hope that you find today's discussion helpful in your work with local grocers and small stores in your communities. Increasing access to and demand for healthy foods and beverages in the retail environment is critical to creating healthy communities for all, especially those experiencing the greatest health disparities. As you know, we simply cannot expect someone to choose healthy foods if they're not available or affordable. Whether you choose to approach your healthy food retail work through policy, like the Minneapolis Corner Store Ordinance, or an incentive-based approach, like healthy food financing or recognition programs like many have done in the communities across the country, the reality is that stores who currently don't stock and sell healthy foods will need the help of public health and other partners to successfully increase both the supply and the demand of these items. To ensure that we have success with our stores, I want you to make sure that you keep in mind that business success as critical for the supply and demand as health. I'm sorry, the slides are just going forward here without me touching them. Okay. So today, the session will address challenges and strategies related to increasing access in rural communities. Our hope is that you identify ways that you can offer value to the stores that you will be working with and form mutually beneficial partnerships. We also will have time at the end for discussion and sharing. As most of you know on the call, the Statewide Health Improvement Partnership's goal is to help Minnesotans live healthier lives and prevent chronic diseases by working in partnership with communities. And this goal and this initiative has been around since 2009. And something that we all need to celebrate related to our collective action is the drop in obesity rates that we've seen in Minnesota relative to the other states surrounding us. This is just an example of how collective effort can improve health when we work together. And a good example of this is the Minnesota Food Charter Network. Collectively, health advocates and community members have identified healthy food retail as a priority area that they think is important. Where we shop also matters, and understanding where people get their food. Most of the food and beverages people consume comes from grocery stores. And as you know, it can be particularly difficult in rural areas to have access to healthy foods. A recent survey found that 66% of Minnesotans shop weekly at traditional grocery stores, but almost 1 in 5 are shopping at convenience stores each week. So we need to keep this in mind as we look at the food environment and try to make improvements. I think this chart depicts very well the issue that we're seeing in our rural communities. As you can see, the change in the number of grocery stores by region between 2000 and 2013 has changed, and it's really hit the rural areas the greatest. The picture that you see on the side here is of Staples, Minnesota. Ernie's is the grocery store in town, and right across the street there is now a Dollar General store. And unfortunately, the foods in that store do not support healthy choices or healthy eating. The Federal Reserve Bank of Minneapolis and Wilder's research conducted a study recently and it was commissioned by Blue Cross Blue Shield of Minnesota to help inform the work in this area. And often you'll hear people talk about food deserts. Food deserts are places where there's low retail access and low income populations. About 16% of Minnesota census tracts qualify as federally designated food deserts, and an estimated 340,000 Minnesotans have low retail access and are low income. So this chart just depicts where some of those food deserts are in our communities, and these are areas where we want to put extra effort to ensure that all people have access to healthy food. One of the great things we all saw occur this year is the passing of the legislation for the Good Food Access Fund. This is really the result of a lot of great effort by a lot of people throughout the community to support healthier access and healthy financing to promote economic development for small businesses and job creation that will support health and small businesses to increase access to nutritious foods for those with the greatest need. It's really got a strong health equity focus, and currently plans are underway to discuss how some of the resources through this fund will be allocated. So certainly stay tuned for that. We will expect to see things towards the end of the year, more information about how to access some of those funds. But we need to keep in mind that just increasing access to healthy food retail stores, saving grocery stores, and building grocery stores is not going to be adequate to improve health. Price still remains the most significant barrier to healthy food consumption for low and moderate income households. And poverty is really a much stronger indicator of health outcomes than is access to healthy food retail. So as we do this work, keep in mind that just building the store or maintaining the store isn't enough. Just getting the customers in the door isn't enough, but ensuring that when the customers get in the door, they're more likely to choose that healthy food item and less likely to choose the food items higher in fat, added sugars, added sodium, so that we can improve health and improve eating behaviors while maintaining strong businesses. So with that said, I am going to turn this over to Julie so that she can tell you a little bit more about some of the policy-based approaches to this work, and Karen will continue to help us understand the business perspective.
Thank you, Teresa. Thank you very much. So this is Julie Ralston Aoki with the Public Health Law Center, and hopefully most of you on the call will be familiar with the center, but I wanted to start off by just telling you a little bit about who we are and what we do. We are a nonprofit legal technical assistance center located at the Mitchell-Hamlin School of Law, here, pictured here in beautiful St. Paul. Our mission is to help people use the power of law to improve health. So we work with public health officials, like many of you who are on this webinar, researchers, advocates, and communities at the local, state, federal, and tribal levels to support development of public health laws and policies that are grounded both in good science and good law, and that are tailored to be workable and right for the specific community. And with support from the Minnesota Department of Health and other great partners, we have had the privilege and good fortune to work with many of you in other communities in Minnesota to support healthy eating and active living policy development. So these are the staff here at the Public Health Law Center, and that's me in the bottom row in the circle. We see really the main primary goal of our work and the work of public health advocates like yourself is to help kids like Drew and Mio here, that's my daughter, and Drew is the nephew of one of my colleagues here, to help kids like these kids to have healthy choices available to them and also to want to choose them. We are also working really hard at the center on how to ensure that we bring an equity lens to all of our work, and I know this is something that all of the public health field is really having some very good conversations about. But we really see that as an important principle that we need to think about how we are helping communities design policies that take an equitable approach to allocate resources, not equally but equitably to better support people who are in underserved communities. And so this is, of course, today's topic is squarely within that arena. Because as we all know who've been working in this field, that healthy food access is a particular challenge for underserved communities, those in greater Minnesota as well as in urban areas where, and particularly for people who are low income or who may be elderly, the vulnerable populations like that. And so this is why your work and the work looking at the role of small stores in food systems in rural or greater Minnesota is so important. So Teresa talked a little bit about some of the information from that Wilder and Federal Reserve 2016 report, which is a fantastic report. If you haven't looked at it yet, I encourage you to take some time to peruse it. But here's some more data that comes from that report, as well as some other research about the importance of small food stores, particularly in underserved areas, both rural and urban. So that report noted that 30% of Minnesotans live in areas where there isn't access to a full-service grocery store, and that in some areas a small store or a convenience store may be the only store, and that even where there are sometimes full-service grocery stores, people still, as the statistics Teresa referred to, still continue to shop or rely heavily on convenience stores or small stores for food. And of course, as we know, those smaller stores tend to stock fewer healthy staple foods, and sometimes even when those choices might be there or in a limited availability, people still don't necessarily choose them. So Karen is going to provide some great information about rural grocery stores in particular and understanding some of the challenges and opportunities in working with them. But I want to talk a little bit more about how the food retail environment influences what people buy and some of the policies that are levers that are available and that people are using to try to shape that environment to promote healthier food choices. So when you think about it, there are essentially two main strategies to try to get better food into underserved areas. And as Teresa mentioned, one important strategy is to try to attract new stores into an area. And the Good Food Access Fund is a great new program that should be available to help support some of that. And communities are also doing other things like trying to provide tax incentives or incremental tax financing to try to help encourage those kinds of new stores. But as we will also be hearing from Karen, and as Teresa touched on, there are a lot of barriers to entry for food stores coming into areas, particularly in many areas in greater Minnesota. So that is not necessarily going to be a very feasible option. So to riff off that song, if you can't be with the one you love, how do you love the one you're with? I want to talk about how do you improve what the stores that are in your community or that are there and work with them to get more healthful food on their shelves. So here's a list of some of the policy systems and environmental levers that can be used to shape the food environment. And the first lever that's listed there is policies that establish a framework or a vision for a healthy food system. These are things like a community comprehensive plan, which many communities are in the process of updating right now or maybe will be updating in the near future, or a food system plan or a sustainability plan. Those are all great policy levers for thinking about healthy food access within the community. Another policy lever is licensing laws. Many communities have the ability to license stores or do license them, and so there's a lot of opportunities to look at those laws and think about how do you use them to provide incentives or even require stores to carry more healthy foods. And Minneapolis' staple food ordinances, which will be the subject of a webinar later this month, is a great example of that, and you can learn more about that at the webinar. Another really exciting approach that many communities are using is to think about how to use incentives. And there are a variety of incentives. They can be programs that are established through law, or they can just be sort of agency programs. One great example is, of course, healthy store programs where a community creates a certification process or provides some marketing support for stores that agree to carry, a certain amount of healthy food or work on the food environment. And then another lever is programs like the Supplemental Nutrition Assistance Program, or SNAP, or the Women, Infants, and Children Program, WIC, which set minimum stocking requirements. And so I'm going to spend a few more minutes talking about those programs particularly because they really provide a good baseline or model for thinking about what should be in a healthy food store and what should that kind of store look like. So first, talking about SNAP. So this program, many of you may be familiar with it. It provides financial assistance to buy food for people who are below the federal poverty line. They get a debit card that can be used at SNAP-authorized retailers. And so the retailers, it's an important program for retailers to participate. It can be a marketing tool to bring customers in, and it also ensures that they're going to have a certain amount of revenue or profit through being able to redeem these SNAP benefits. Now, under the current SNAP rules, authorized retailers can qualify if at least 50% of their sales are from staple foods, which are foods in these 4 categories, basically protein, meat, poultry, or fish, bread or cereals, vegetables or fruits, and dairy products, or if they stock a minimum amount of each kind of staple food, including some perishable staple items. And so I have a summary there along with the citation if you wanted to go look it up. Now, an important thing for you to know is that these rules are being revised. Under the 2014 Farm Bill, Congress enacted some additional stocking requirements, and then the Food and Nutrition Service, in implementing those, issued a rule that also included some additional requirements. So that rule was out for comment earlier this year. We're still waiting to hear the final word, but here is what was proposed or included in the Farm Bill, that those stocking requirements would be expanded from 3 types of staple foods to 7 types from each staple food category. Then at least 3 categories have to include perishable items. That's an increase of 1. And then the new rule would require that 6 at least stocking units for each type of food be there. So that would really greatly increase the amount of staple healthy foods that are in these stores. Now, of course, these rules are not without controversy, so it's likely that there will be some revisions. One of the areas that was really heavily commented about was that the proposed rule also narrows the definition of what qualifies as a staple food, so that commercially processed foods and prepared mixtures with multiple ingredients that don't represent a single food category will not count anymore, so in that 50% or that threshold requirement. So think about if yogurt will still be okay, but pizza will not be. And the new rule would not allow accessory foods like snacks or desserts to be counted as staple foods. So we'll have to see what happens. I understand that USDA is also looking at providing a tiered system and technical assistance to help stores that are really in really underserved areas and may have significant distribution channels in meeting these new requirements, but we'll just have to see what happens. We do have a resource available that highlights or summarizes the new rules, and you can find it on our website there. Then I want to talk about the women, infant, and children standards because these are also minimum stocking requirements. With the WIC standards, the federal government sets guidelines, but states actually have some room here to tailor the guidelines to their specific areas. And so in Minnesota, it's both pharmacies and retail food stores that are SNAP authorized that can participate in WIC. And the WIC standards require a larger variety of products here. I have all the different categories listed, but there are slightly different stocking requirements depending on whether the store is in a Tier 1 county, which is Anoka, Hennepin, Dakota, or Ramsey, or a Tier 2 county. And so I just highlighted there a couple of the differences. This is not all of the differences, but just a couple of differences. So states also have flexibility in terms of what amounts to require, whether they can allow certain added seasonings for some of the foods, and tailoring the minimum stocking requirements based on store size, population, sales volume, and other factors. If you wanted to look at those more, I have a link there to where you can find these. And then finally, I wanted to talk about this set of recommended minimum stocking guidelines. These were developed by the Healthy Eating Research Program of the Robert Wood Johnson Foundation, several key staff of whom are here at the University of Minnesota, with participation from a panel of experts from all over the United States, which strangely enough included me, where we worked on reviewing definitions of stores, minimum stocking requirements from WIC and SNAP, and Healthy Corner store laws and programs. We looked at the research and came up with a set of recommended guidelines. We also developed a definition of what is a small store, which includes dollar stores, pharmacies, and stores that accept SNAP or WIC, and developed 2 tiers of minimum stocking requirements. One is a basic level and one is preferred. And the reason for that was to allow some flexibility, recognizing that some very small stores may not have access to affordable distribution channels or any channels for fresh produce, or may have very low sales volumes. And then the standards also include a set of recommended marketing strategies that can be used to encourage shoppers to buy the healthier food and beverages. And so that's also a great resource to look at for ideas for certain like pricing, placement, and promotion strategies to use. Those are for all stores, there's no tier for those, and they would also be applicable with larger stores. And I know there's some research being done on these guidelines and perceptions about the feasibility of implementing that, and so that should be coming out later this year. It'll be great to have that research. So these guidelines, all these guidelines, the SNAP, the WIC, these HER guidelines are all really great resources for thinking about, how do we define what is for one, what is a small store, and then also what should be in a small store. And so this is an approach that you should incorporate into, as you are working here with groceries or small stores in your community. These are standards that you can look at and use to have conversations with store owners about. And here are other things that you can do, which I know many of you are already doing, collecting information to understand the landscape. This is what those assessments are about, and Karen will also have some great information to share. And the goal here is to really try to raise the bar or raise the level of acceptance for what should be in a healthy store. So thank you for your attention, and with that I am going to turn it over to Karen to talk about the terrific information and the lessons learned about the landscape for rural grocers.
Great, yeah, thank you, Julie. Well, and thank you all for having me on to talk today to all of you about our work that we've been doing at the regional partnerships with rural grocery stores across Minnesota. And I'm hoping that this presentation can spark some ideas for your work, lead to collaboration opportunities around grocer needs. So I'll introduce myself a bit more on the next slide, but I wanted to note that our statewide director, Kathy Drager, has been a huge part of the success of both the survey that we conducted last summer and some of our ongoing projects because of her connections and passion for this rural grocery work. So I wanted to do a quick shout out to her. But this is me, because I always think pictures are nice to have. And if you see me around, I am the Assistant Program Director for Sustainable Agriculture and Food Systems with the Regional Sustainable Development Partnerships, part of the University of Minnesota Extension. So that is a mouthful, but the regional partnerships are an organization that support community-university partnerships in 4 areas of sustainability. And our 4 areas of sustainability that we focus on are natural resources, tourism, clean energy, and food systems. So I work within our food systems team at the statewide level. And what that means is we have 5 boards in greater Minnesota, you see them here in this picture in the center, that identify sustainability needs in our 4 areas and support community-university partnerships. So I work along with 2 other colleagues in our statewide office to link those community-driven projects with U of M researchers, assist in searching for other funding as needed for those projects, and coordinating multi-regional and statewide projects that we have going on. So currently, a number of projects that I'm coordinating are related to rural grocery needs. And I'll talk a little bit about how we got started really focusing in on that area. So it all began really in the community. And it goes back quite a number of years, actually. we recognized early on that rural grocery stores are an anchor business on Main Street, and then once they're closed, they're oftentimes difficult to reopen. So this goes back way back, for example, to the work in 2007 by Gigi DiGiacomo, who is now in the University of Minnesota Applied Economics Department. And she focused on, what grocer interest was in carrying local and organic foods back in 2007. We also had a number of colleagues within the partnerships have a chance to attend the Rural Grocery Summits that are held every other year by Kansas State University, and even had a chance to take a busload of Minnesota grocers to the summits in 2014 and this past year in 2016. You can see that in the upper right-hand corner. And throughout that process and through the conversations that were starting to be had with grocers, we had some of those community-driven projects start to surface, projects related to accessing healthy food in rural stores, to maintaining the quality of fresh produce, and more. So at the time that all this was kind of bubbling up, we realized that there was a need to really comprehensively understand the challenges that small stores are facing in rural Minnesota. We wanted to understand issues like produce coolers and having aging equipment. As you can see in this photo, this is a produce cooler that's probably from about the 1950s or 60s. And how does that play into the store's ability to be successful? Just physical building infrastructure was another area we wanted to study, access to capital to make changes, intent to stay in business. So luckily, the Kansas State University is really a leader in examining rural grocery issues and had conducted a survey of Kansas rural grocers in 2008. So we were able to use their survey as a starting template for the kinds of questions we'd like to ask, but worked with many, many stakeholders, including rural grocers themselves, the Minnesota Departments of Health and Ag, Center for Rural Policy and Development, and those are just to name a few. And together, we came up with a 60-question survey, which was the size of a small book, and we were a little nervous, well, how is this going to be received? But we worked with the Minnesota Center for Survey Research to help conduct those mailings and initial analysis. And these survey funders shown here, a number of ag lenders and the Minnesota Department of Agriculture really helped this survey to happen. So here is the booklet. And again, this was 60 questions long. It was mailed out and data was collected between July 2015 and October of 2015. And it was sent to rural grocery stores in communities of 2,500 or fewer residents. And this is based on the U.S. Census definition of rural. And it's also the parameter that Kansas State University used when they surveyed rural grocers across Kansas. So we had 254 eligible stores to take the survey across the state, and 175 of those returned the survey for a 69% response rate. It really made us feel glad that so many were interested in sharing feedback, and in fact, many wrote within the survey how appreciative they were to have their opinions asked for. So as a result, we spent the beginning of 2016 really focused on what's the initial results that we can get out of the survey to start sharing with others and really begin addressing some of these challenges as soon as possible. So we lumped the 60 questions. Most of them are covered in these fact sheets. And the topics that we lumped those results into were business characteristics, fresh produce and locally produced foods, energy usage, and efficiency. And you can find those at the hyperlink that I've got there at the bottom of this slide. And that hyperlink will be posted on my final slide as well, if you don't have time to write it all down at this moment. So a little overview on some of the highlights of what we found. To begin with, our survey confirmed that rural grocers are serving customers over a very large service area. As you can see here, only 5% said that the farthest their customers were traveling was within 10 miles. Almost everybody was serving customers as far out as greater than 10 miles, and for some, serving customers that were maybe even 30 or more miles from the store. And we were also curious, besides individual customers, what other institutions are being served by grocery stores? And this is specifically looking at the stores who also sold fresh produce. 92% indicated that they sell fresh produce in their stores across the state of those we surveyed. And those 92%, 55% were also selling to restaurants, 35% to daycares, 32% to schools. So the big takeaway from here is that grocers are not only serving individuals in the community, but also other institutions. And while we were at it, we were curious what the relationship was like with local producers in the community as well. And so as you can see here, grocers are oftentimes purchasing at least some from farmers in the local community, but local farmers are rarely a major supplier of fresh produce for the store. And this is something that I would have expected just given the seasonality of Minnesota's local produce. There are ebbs and flows, although like my colleague Greg Schweizer is working on some innovative designs for features like deep winter greenhouses that could hopefully help Minnesota produce healthy fruits and vegetables more on a year-round basis. So this was intriguing to see how many stores did have a relationship with local farmers. And then, in addition, we wanted to know of those local products, what types of products are being purchased. So fresh vegetables and local honey were towards the top for items bought. And at the bottom were locally grown grains and local nuts. And this low purchasing may be more related to a lack of availability than a lack of interest, just knowing farmers across the state through our organization and the types of products that they grow, but we would like to explore this further. So here's a question that we took right from the Kansas survey, and it's about challenges. As you can see, competition with large chain grocery stores was at the very top of major and minor challenges for grocery stores. And then the second was high operating costs. So going back to that old, aged, 1950s cooler that we saw earlier in the slide deck, that's a question here of how is that old cooler contributing to the high operating costs for the grocery store. And thirdly, narrow profit margins are a real struggle too. So if you have aging infrastructure, how are you going to save up to make the changes that you need to address those high operating costs? Alrighty, and then we want to kind of get a feel for what is the store ownership like on the landscape. We found that 3/4 are privately owned small businesses, some cooperatives, some corporate franchises. And of these, many grocery stores are operating in physical building infrastructure that is very old. So, we have more than 50 years old, 43%, and even for buildings that are 16 to 50 years old, that's another 44%. A lot of grocers are dealing with an older building structure. So one of the last things I wanted to highlight before quickly touching on ongoing work and ways that you might want to work with grocers in your community is our questions on transition planning. And this really gets to the timeliness factor and the importance of this work. We wanted to ask how much longer the owners surveyed planned on owning their store. And as you can see here, over half of rural grocers planned to only own their store for 10 more years or even fewer years. So this on its own is not necessarily bad if there's a transition plan in place, but we did also ask about transition planning, and family businesses that are going to be passed down within the family had the highest likelihood of having a transition plan in place with 29%, but that percentage just goes down in other business transition planning options. So there's clearly a lot of owners that are going to be planning on leaving the grocery business in our rural communities in the near future, but not necessarily the transition plans in place to ensure that those grocery stores will stay open as a place of healthy food access in these communities. So we wanted to get started right away in both sharing this information and also doing what we could on our part to help address some of the issues identified. So one issue identified was that 91% of grocers who sold fresh produce indicated selling produce before it deteriorated was a challenge. And in response to that, the regional partnerships led a series of in-store demonstrations with a host rural grocery store in each of our 5 regions around the state, where we brought in presenters to talk about handling, storing, and marketing fresh produce, and then followed that presentation with an in-store tour to actually put the new knowledge learned to test in the host grocery store's produce case. And participants who came to those in-store demonstrations received this quick reference guide that's on the far right side. This front side here is vegetables, the back side is fruit. And this is going to be part of a comprehensive toolkit that's coming out later towards the end of this year on fresh produce handling and marketing. Also, we have Fritz Ebinger, pictured here on the left, as part of our partnership's clean energy resource teams, the part of the regional partnerships that focuses on our sustainable energy mission. And he has reached out to a number of grocers since the survey came out to offer assistance and consulting on different energy efficiency audit options and options to apply for programs like REAP, this Rural Energy for America program that's put out through the USDA. But there's a number of ways that we can work with rural grocery stores interested in increasing local and healthy food access. And in fact, a lot of rural grocers, just anecdotally, who I've had a chance to work with, are interested in carrying healthy and local foods, but just may struggle with some of the technical expertise or the time to really focus in on that and what they can do in their individual store. So here are some strategies that we've seen stores use successfully around the state. Actually hosting farmers markets outside of the store has been successful with a few stores we've talked with. It draws customers to the store, and although it may seem initially like a competition between the farmer grown produce and the produce within the store, there's actually a lot of benefit to customers coming into the store to get whatever items that they can't get from the farmer's market, be it, pasta or beans or eggs. Lots of farmers markets have an egg vendor, but there is a good connection there where it draws a lot of customers into the store. There's also a cross-marketing opportunity where the farmer's market benefits from the grocery store promoting it, and the grocery store benefits from having their logo within the farmer's market information. And those are just some of the benefits. Another benefit is that customers get to know the store and think to come back to it even on non-farmer's market days. And it's a very similar concept to hosting a CSA drop site. And with the CSA drop, again, customers will get only certain items within a CSA box. So they may want to come in to pick up limes or lemons or other products that you just are not going to find in a Minnesota CSA box. And here's a few other ideas. I won't spend too much time on them, but selling on consignment. If a grocery store is worried about purchasing a lot of product from a farmer and then not being able to get rid of it all, that's an option. There's also farm to grocery, which is pictured here on the right-hand picture. Gosh's Grocery in Randall, Minnesota, in the central part of the state, partnered with Grandpa G's produce just this past summer, midsummer, to carry some of Grandpa G's product. And this is a good visual of that cross-marketing opportunity. Grandpa G's has their logo here on the banner within Gosh's Grocery, and Gosh's is also showing their customers that they have something unique to offer. And that's really what this last bullet point gets at. There's an opportunity for grocery stores to benefit by showing their customers that they're unique from the super center down the road or the dollar store down the road. But I wanted to highlight there are things we should really keep in mind when approaching grocery stores to work with them. One is that it's important to be ready to listen. Research by colleagues like Hikaru Peterson, who is now with our University of Minnesota Applied Economic Department, but was at Kansas State University, she showed that differentiation of rural grocery stores from their competitors is a real key for them both surviving and thriving in the coming years in this environment. But, and it can be done through strategies like I was just highlighting, offering local produce, hosting farmers markets, excelling in customer service can be a real differentiation tactic. But the listening comes in that grocers are under many pressures, and it's important that we, stop and first listen closely and empathetically to the challenges that are unique to their store before, asking tactfully about some of these potential solutions and potential ways to differentiate each other. I think we all might be familiar with having spouses or significant others who have tried to give us solutions when we have faced a challenge in our lives, and if that solution is offered too early, it can sometimes not work out so well and not be ready to be received. So secondly, I wanted to point out that come knowing what expertise and resources that you can offer. And if there's an interest in working together, what can you do to minimize the time expectations on the part of the grocer? A lot of grocers around the state and rural areas are putting in 50, 60-hour weeks, sometimes even more than that. And there's not a lot of time to implement new great ideas, even if they're recognized as good ideas. So something that local public health and extension might be able to offer to help with, to take some of that load off of rural grocers, is helping connect store owners with SNAP and WIC marketing materials, helping, guide that process, because it's a lot to keep track of what Julie just covered. Help providing supplies, baskets, displays, and just thirdly, another example would be help providing other positive public relations and educational messaging to the community about how this is a store where you can access healthy foods. And then thirdly, I just wanted to mention again, which I sort of mentioned during the listening section, that there are multiple stresses at any given time on a grocery store. It's the competition with supercenters, but it's also that aging cooler, and it's also maybe a roof that is at risk of starting to leak. So as much as we are able to help connect grocers to other resources, other people who can provide that knowledge and expertise, like business planning or loans or infrastructure development, that will really be something appreciated and of benefit as well, because it's never just carrying healthy produce, it's all these other challenges as well. So with that, as promised, the URL to the fact sheets that I was pulling that data from, and then also a bunch of other resources is right here below. Also, you've got my email and my phone number, so if you're thinking about this as time goes on and want to ask more questions, please do reach out.
Well, thank you, Karen. This is Julie again. I'm just getting back on the line. I wanted to relay a couple of things that came in through the chat panel. Somebody was recommending people take a look at the Farmhouse Market in New Prague. I don't know if you're familiar with that business, Karen or Teresa. I just checked it out very quickly, their website. It looks like they're open 24 hours a day with key card entry. It's like an indoor farmer's market. It looks pretty cool.
Yeah, no, I met the woman who started that kind of a new style of a grocery business actually at the Kansas City Rural Grocery Summit this past June, and that's exactly what she's trying out, is kind of a novel approach for her community where it takes a lot of staff time and dollars to pay staff to be at the cash registers actively, monitoring and shelving the store shelves, and I'll be curious to follow her model and see if that's a good fit for her community on how to be available to customers through that key card access, but also recognize being able to work within the tight finances of running a grocery store.
Sure, yeah. And then another model was a Good Grocer in here in Minneapolis. So that also looked like an interesting, you know, experiment there. I don't know if you're familiar with that one, Karen.
Oh, no, I'm not as familiar with that since I work more in the rural parts of the state, but maybe Teresa or you know of it better?
I do not, but I do think as these unique approaches are identified, you know, there's something to keep in mind for other communities to potentially model, potentially access funding through the Good Food Access Fund.
So yeah, it's a volunteer-run store, and so people who work there get a discount on groceries, and so they really emphasize stocking healthy foods there. So, those are some interesting examples for people to look at. I just wanted to reinforce something you were saying about working with stores or store managers, and you know that those new SNAP rules are going to be, when they are finalized, I mean, even if they are relaxed a little bit from what was proposed, I think that's going to be a change for a lot of stores, and so a great role for public health and advocates would be to help support those store owners in implementing those new rules, and because that's a great, you know, it's a win for a community, it's a win for the store, so that would be a great area for public health and advocates to help. A question came in if there was if there's been a health impact assessment done on the topic of a Dollar General or dollar stores and their impact on rural grocers. That's a great question. I don't know of a health impact assessment that has been done on that phenomenon. Karen, do you?
Off the top of my head, I'm not thinking of a specific resource, but I'd like to, I'm making a note of that question, and I'm going to look into that further. I know we have colleagues who have studied the effect of, colleagues in Extension who have studied the effect of supercenters coming in, and I think that they got at that health impact assessment, but I would like to look and double check whether we've got colleagues who've done it for dollar stores.
Mm-hmm. Teresa, do you have anything that you'd like to add?
You know, there is not one that I'm aware of either, so I look forward to hearing what you learned, Karen.
So, Karen, I have another question for you, and if I don't know, maybe you covered this and I just missed it, but how did you decide who to send the survey to? Could you talk a little bit about that?
Oh, sure. Well, you know, I mentioned the one factor that we kept from the Kansas survey was looking at towns of 2,500 or fewer. You know, it's partially because of that U.S. Census definition, but as it turned out, just looking across at the different stores across the state, that also tended to be where you'd get more of the individual privately owned grocery stores rather than some of the smaller chains. And we were particularly interested in learning what those individual or, you know, just a very small chain of stores, what those owners were struggling with. And we also looked for stores that had, well, we used a Dun & Bradstreet, I believe I'm saying that correctly, database for starting with for stores across Minnesota that fit that size parameter, but then also just did additional database, you know, building on our own to identify those stores that carried a full grocery range. But yep, that was the parameters that we looked at to find those stores.
Julie, this
thank
is
you.
Teresa.
Go ahead.
Hi, and I'm wondering from our audience of listeners, if anybody wants to comment on what opportunities they're seeing if they're conducting the nutrition environment measurements in their communities, or what they see as some of the more urgent needs for their communities related to healthy food access in stores.
We would welcome your comments if you could type them in through the Q&A window or the chat window. while we give people just a minute to think about that, Teresa, Karen, actually, let me just talk about these two webinars that are coming up. We have one coming up next Monday, which is about using law, policy, and practice to support access to healthy and safe food in Minnesota. That is going to address key challenges and opportunities identified by Minnesota communities in their work to increase access to healthy and safe food. The speakers are going to discuss key barriers limiting local efforts to promote healthy food identified through the Healthy Food, Safe Food Project, which is a joint initiative between the University of Minnesota Extension and Minnesota Department of Health. And then we will also talk about the regulatory and legal framework governing food safety and resources available to support local efforts navigating food safety laws and opportunities to work with state and local food safety inspectors. Then the next webinar will be closer to the end of this month on October 25th. This is about engaging stakeholders in healthy food retail assessment and policy development. It will feature staff from the Minneapolis Health Department to talk about their staple food ordinance and how they implemented it, share lessons learned, and talk about sustainability. And then it will also, the last 10 minutes of the call will also include counter tools and allow time to connect with them about your retail assessments that you might be doing, and for people who are using the Store Audit Center. All right, so repeat the question came in. Teresa, do you want to say that again?
Oh, I'm just wondering if there are people out there who've been working with their stores and perhaps have done assessments or have observed kind of some of the needs they're seeing related to healthy food access in stores, or what challenges they've identified.
So challenges, needs, and getting healthy food access that you might have identified in your work. And in the meantime, I had another question come in about the time frame on the final rule requiring more staple foods for stores, and what is the Federal Register citation. So the time frame is unknown to me right now. There's a lot of things happening in our federal political arena, so it's a little hard to say when these things might be coming out. And I can send around the Federal Register citation after the webinar. We'll just send it out to everybody. And then a question came in. This was, I think, to your question, Teresa, a great comment from Josh Romaker. He said, just getting WIC and SNAP signage in the store was an easy win. That's a great point. Thank you, Josh. And then another contribution from Marilyn Hofland says, she was working with a wholesaler who only offered a whole or a half case of produce. A quarter case or mixed cases would be good options. Also a trade-in program for old equipment. Those also sound like great ideas. Thank you.
Yeah, I just would add on to Josh's comment quickly that we had a similar situation where we were working with a store that was carrying some local product, but it locally grown produce near the store, but they didn't have ways of really advertising that. So we actually took the time and just got on the Minnesota Grown website for them. Those Minnesota Grown stickers and other signage resources are free to grocery businesses and the others who are selling farmers' products. And so just taking that extra step of, we asked the store first if they'd be interested, but then doing some of that legwork for the store really made a big difference. And they've been, they already need a new roll of some of those stickers, so it's been working well.
Well, great. It seems like there aren't any more questions in the queue. So I would just want to say thank you very much, everyone, for your attention. Again, 2 more webinars coming up, one on Monday about food safety and supporting access to healthy and safe food, and one on October 25th about lessons learned from Minneapolis' staple food ordinances. We hope you will join for those webinars as well. And Karen and Teresa, any final words?
No, I just want to thank both you and Karen for your great presentations, and for our audience for their attention and comments.
Yeah, great. I'll say the same thing. Thanks for the opportunity to talk about this, and the more that we're sharing ideas, I think the better off we'll be.
Wonderful. Absolutely agreed. Thank you. And again, the link and PDFs of our slides will be available online, hopefully as soon as tomorrow, so that you can, if you didn't catch all these URLs, you can get the information there. Thank you, everyone, again, and have a great rest of your Friday day.